This video focuses on the multiple options that Prairie State College nursing majors can use to become both an RN and to go on for their Bachelors of Science in Nursing or BSN degree. I will be going over the three most common types of BSN programs offered at universities. There is the RN to BSN program, which is specifically limited to students who already have an associate's level degree where they did clinical training and they are registered nurses. This is for students who are graduates of our nursing AAS program. The traditional BSN for students who've only taken prerequisite coursework at Prairie State and wish to do their clinical training at a university. And the third kind you'll see on university websites is typically called an accelerated BSN, though sometimes it has different names. This is for students who have a bachelor's degree in another field and are wanting to switch to nursing and are using the BSN to move on to that. This last one is not a common path for Prairie State students. If you are looking into an accelerated BSN, you typically want to be working directly with the university that offers that program. A little bit more about the RN to BSN degree. It is referring to graduates from our nursing AAS degree or throughout the country that specific degree where you take both the prerequisites and complete the clinical nursing training before graduating with a specialized associate's. It's called an ADN, an associate's degree in nursing. So if you're a graduate of our nursing AAS and you see a university's website refer to an ADN program, they're talking about you. Prairie State College nursing AAS graduates sit for the same RN exam, the NCLEX, as all BSN graduates take as well. So to become a registered nurse, everyone takes and passes the same test. The RN to BSN is a wonderful, very affordable option for Prairie State nursing AAS graduates. There are many universities both locally and throughout the country that have this specialized option. It is typically online. This is because most people are working as RNs, your shifts can change significantly, and so online is the best way to help everyone get through the program without having time demands of going into the classroom. Because they are typically online, most universities significantly discount the tuition. They just have it set as a lower rate. They usually publish the amount of the cost of the entire program, not the yearly cost. There are some programs that are as low as $10,000 for the whole program to finish from the RN to complete the BSN. Eastern Illinois University and Purdue Northwest are two schools that have recently shared data that their entire RN to BSN completion program is $10,000. A more common amount is between $15,000 and $18,000 for the whole program. This is not by year, but to complete the bachelor's degree. Universities with RN to BSN programs do not make you repeat any nursing coursework. They take everything that you've done at Prairie State and then just finish you out to your BSN. Most students going the route of earning their RN degree and then continuing to an RN to BSN from Prairie State to a university are planning to work as a nurse right away, and they're planning to work for employers like hospitals and other large health care organizations who typically offer tuition reimbursement, where the employers could end up paying for all or part of the BSN. So Prairie State RN graduates are often planning to have their employer pay for their bachelor's, making it even more affordable for them. RN to BSN programs are typically faster than the clinical training portion you're going to get at a university in a traditional BSN. Some programs are completed as quickly as 12 months. Some can be 24 months or longer if you wish to be part-time. The most common amount that universities tell me for the time to complete the RN to BSN program is 15 to 18 months. The traditional BSN is for students who are earning an AA in nursing who are taking only the prerequisite courses at Prairie State and are not taking the clinical training, not doing the special admissions and clinical training at Prairie State. Instead, they're doing the university's special admissions and clinical training directly there. These programs at universities can be as short as 2 years and as long as 4 years, regardless of the prerequisites, even if you have them all completed. The most common amount of time is 2.5 years. The schools, local schools that do a 2-year clinical training program to complete are the University of Illinois at Chicago and Indiana University Northwest, which does have a discounted tuition for Illinois residents, making them price competitive for state Illinois universities. 2.5 years is the most common. Often schools will have 1 semester that you're there taking prereqs and before you start officially the nursing sequence. I'm warning you about this so you can be sure to be asking the admissions officers at the universities you're interested in to see how their programs run. Taking 4 years to complete the nursing sequence for a transfer student is very uncommon. I only know of 1 local university that does that. That is Purdue Northwest University. They have a sequence set up for their freshmen and they had not changed a sequence for transfer students. So I find most students that's not the school that they prioritize. The accelerated BSN is again a unique program. It doesn't exist at most universities, and this is for someone who has a bachelor's degree in another field and wishes to get a second bachelor's to become an RN. Sometimes students will end up coming to Prairie State because they need some prerequisite courses to then do an accelerated BSN at a university, which is fine. We love to have you. We just want to make sure it's in your best interest, and to be sure that it is, you want to be in direct contact with the admissions officer at the university that has that BSN. So making sure they check out the transcripts of what you've already completed, the program you're interested in, and your plan to take more classes at Prairie State. You definitely want to be hearing that directly from the university's admissions officer, that everything is set. So it's not a first plan, but it's a great option for people that are changing their careers later. All right, I have a lot more videos that can help you as you figure out your options and research your resources for yourself in planning as your nursing major. There are 3 videos. I have them all here on the website with a quick summary of what they talk about. I have them linked in the description of this video. You want to check these all out. This video plus the other 3, the 4 together, I'll summarize the common information I go through with nursing majors I speak with in person, and this way you benefit from the knowledge now. The first video shows you how you can find transfer guides. Nearby universities have put things on their website that show how our classes are priorities and meet requirements for their degrees. It helps figure things out for you. The next video, College Navigator, allows you to search. You can choose the program Registered Nursing, and you can search locally throughout the state of Illinois, throughout other states, or throughout the whole country. You can see what schools have registered nursing programs to see all of your options that you could be looking into. The last video is where I go into NCLEX pass rates. This is a really important assessment that nursing schools are judged by, one of many criteria in maintaining their nursing accreditation. And you also want to be consulting this when you're choosing what school to go on to as well. Quick spoiler alert, Prairie State's nursing program has awesome pass rates, and that's actually often better than many universities out there. So check out that video so you can learn more. Finally, next steps, how to take action. If you are interested in taking the nursing AAS and taking the prereqs and the clinical training both at Prairie State, then the Prairie State advisor, who is your go-to person, she's an awesome expert, is Tracy Jones. Her email is on this webpage and linked in the description of the video. And then if you are looking to take prerequisites only and then go on to a university for a traditional BSN to take the clinical program at the university, then you want to work with a Prairie State advisor in combination with the resources on the last screen, which I have linked as well. or email advising@prairiestate.edu to get connected to someone. Thanks for checking out this video. Be sure to check out the other ones. I have lots more general videos that are not about nursing on my YouTube channel. Check them all out, see what it can help you out.